Hi there, I'm Marlene Moster from the Glaucoma Department at Wills Eye Hospital, and I'd like to talk to you about why it's so important that you follow up for your glaucoma care with a physician and make sure that your medications are current. Around 3 million people in the United States today currently have glaucoma. And if you're over 40, about 2.7 million of those people have primary open-angle glaucoma. Besides cataract, it is the leading cause of blindness in the United States and the world, and therefore it cannot be ignored. As you get older, glaucoma prevalence increases, and therefore it is so important that you get your eyes checked at least once a year, and when the diagnosis of glaucoma is made, your follow-up is consistent. This means that you must take your medication so that the optic nerve and the visual field does not get worse. What does that mean? That means that the visual field will go from normal, as you see here, to darker and darker and darker, to at some point you have a visual disability. That means you won't be able to drive, you can't recognize the food on your plate. It's possible you won't see the faces of your children or your grandchildren, because as the pressure goes higher, and if you're not taking the medicine and not following up with your doctor to make sure that everything is stable and well controlled, the visual field will close in over time and the optic nerve will start to die. When that happens, oftentimes you move on to needing laser or even surgery, and you can almost always prevent this if glaucoma is detected early, if you follow up with your doctor on a given time, because glaucoma is usually painless. You don't feel yourself getting worse. You don't feel the optic nerve deteriorating, which is why every couple of months you must make a visit to your doctor so that the intraocular pressure is perfectly controlled for you. That means taking your medication even though you don't feel that you're getting better or getting worse. It's one of those things. It's like treating high blood pressure. You don't want to wait for the stroke. You want to treat the high blood pressure before you have the stroke. And that's the same idea with treating glaucoma. You want to take your medications so you don't go blind. And blindness is a real thing. There are millions of people throughout the world blind, and they continue to go blind because their care is poor. They don't follow up. They don't go see their regular eye caregiver so that the pressures are not checked and the pressures are not well controlled. So I urge you to make sure that you follow up with your physician and that the glaucoma does not blind you. Thank you very much.